Hello, today I'm going to talk about selective serotonin reuptake inhibitors, or SSRIs. Common examples within this class include sertraline, citalopram, and fluoxetine. SSRIs are the most common antidepressant used. This is because they are generally well tolerated with fewer side effects than other antidepressants and are safer than other antidepressants in an overdose. SSRIs are indicated in moderate to severe depression or mild depression which has not responded to psychological treatment. SSRIs are good for depression with combined anxiety and can also be used in panic disorders and OCD. Patients should continue SSRIs for at least 6 months after they start feeling better to stop concurrent or recurrent depression. However, the SSRIs do have some side effects. The most common is gastrointestinal upset. This includes effects on appetite and weight disturbance such as weight gain or loss. Another side effect is hypernatremia or low sodium. Elderly patients are particularly prone to low sodium, so SSRIs should be used with caution in this group. Suicidal thoughts may increase in patients taking SSRIs, particularly in the first few weeks of using this therapy. This may seem strange considering this drug is used for depression, but the risk of this occurring is small but also very real, so you must alert patients of the risk of suicidal thoughts. SSRIs can lower the seizure threshold. This is important to remember in patients with epilepsy or who are taking other drugs which can also lower seizure threshold. Certain SSRIs such as citalopram prolong the QT interval and can lead to arrhythmias. A patient should not stop SSRIs suddenly. This can cause withdrawal syndrome. Withdrawal syndrome is a flu-like syndrome with GI upset and sleep disturbance. To stop an SSRI, a patient must reduce the dose slowly over 4 weeks. SSRIs can also predispose to increased risk of bleeding, so should be used in caution in patients with peptic ulcer disease. When starting an SSRI, you must think, is this the best option for treating depression? SSRIs can be used in all severities of depression and depression mixed with anxiety. Patients on SSRIs should be reviewed 2 weeks after starting therapy. Those under 30 are at increased risk of suicidal thoughts should be reviewed within 1 week of starting therapy. There is also a risk of serotonin syndrome, which is very rare. Selective serotonin reuptake inhibitors increase the levels of serotonin, and if the serotonin is increased to a very high level, this may cause serotonin syndrome, which will cause a restless state in the body and will lead to autonomic, somatic, and cognitive dysfunction. The patient may become hypertensive, tachycardic, may shiver and sweat. They may have tremor, shaking, and myoclonus, as well as cognitive effects such as confusion. Again, this is a very rare side effect, but it is useful to include in discussions with patients to give them a holistic picture of what it means to be taking SSRIs. Thank you for listening to this video. If you liked the video, please don't forget to click the like button and subscribe to this channel.